Hello everyone, here we are with an OET speaking role play for nurses. In this task, the candidate will play a nurse role in a hospital ward. The patient is a 7-year-old who is in hospital after surgery to remove a large lesion from his back. He is recovering well and you want him to get up, to have a shower and do some exercise. The interlocutor, on the other hand, plays the patient role who want to make the most of the rest and the hospital food, but to be otherwise left in peace. However, a nurse says it's time to have a shower and exercise. During the role play, the candidate should mention the given tasks in the role play card, which are finding out the patient's current mood and ask to check the state of the wound, reassuring the patient the wound site is healing well, and emphasize it is now time to have a shower, promoting the benefits of having a shower, advising that a waterproof dressing will be placed over the wound, recommending the patient start doing gentle exercises, and finally, stressing the importance of exercise.
Good morning, Mr. Stiavas. My name is Sanin and I'm a nurse on duty today. I see you had a surgery yesterday to remove a lesion from your back. So, how are you feeling now?
Hello. I'm just so irritated with the nurses. They come time after time, and I just want to left alone and rest.
I understand that you don't want anyone to disturb you. However, the nurses should frequently check your vital signs and your wound to make sure everything is fine. Now, would you mind if I can check your dressing and your wound?
Okay, do as you said.
Okay, and let's see. It seems you are recovering quite well and your wound is fine also without any active bleeding. So I think it's the time to get out of the bed, have a shower, and do some exercise. How does it sound?
Well, I'm not so sure about that. I prefer to take shower once I reach home after surgery. For now, I want to take the most of the rest and food without anyone disturbing me.
I see that you want a complete bed rest, but let me tell you, you need to take shower at least once a day to prevent the spread of infection. It also helps you to feel more relaxed and less ill, and I think it's the best way to boost your mood and increase your comfort.
I do understand that, but are you sure it is safe to take shower after surgery? I mean, I don't want the dressing and the stitches to get wet in the shower. I'm sure if the wound gets wet, the chance of infection will increase, isn't it?
That's right, and let me reassure you that there is nothing to be worried about. We will apply a waterproof dressing on your wound to make sure the water will not touch your wound. Isn't that okay?
Alright then, a quick shower would be fine. But after that, I prefer to get back to bed. I'm quite old and I need more rest. I never do exercises when I'm home and I was fine all these years.
I appreciate why you think that, but it's not a good idea to just stay in the bed and not doing any exercise. This will increase the chance of developing clots in your blood, and that would be a serious complication, and we don't want that happen, right?
Right.
So physical activity is very important. It improves your blood circulation and helps your wound to recover faster. Besides, I'm sure you feel more relaxed after that. So let's start with some gentle exercise like stretching or maybe walking down the hall. Do you think you can do that?
Well, it seems I have no other options. At least I can visit my friend Mabel. He is in room 103.
Okay, sounds perfect. And do you have any other questions or concerns that I can help you with?
Well, there's one thing I was thinking about. After surgery, when I get home, how can I take care of my wound and dressing?
And that's a good question. We will give you an instruction on how to change your dressing and clean your wound. Also, you will be provided with any equipment that you may require, such as medication, dressing, and bandage.
Then, that sounds great. Thank you.
You're welcome.